Hi all of you, welcome back to the lectures by Dental Amaze Academy. Today we are going to start a new topic in microbiology, which is Nesseria, and you have got two organisms out there, which is Nesseria gonorrhea and Nesseria meningitidis. And as I've told you in the lectures of pneumococci, these are also diplococci, that is two cocci, okay, diplococci, not multiple like chains or grape like clusters of staphylococci, nor like the chains of streptococcus aureus. Okay, now these are diplococci, and yes, one thing I want you to note here is they are lenticular diplococci. Pneumococci was lanceolate, leaf like. This is lenticular, that is lens shaped. Okay, not very much lens shaped. I'll show you the image typically when we compare these two, but these are basically lenticular or lens shaped. Fine. So what we're going to do is we are going to compare initially Nesseria gonorrhea with Nesseria meningitidis, then we go to go into detail of each organisms. Okay, so that right in the beginning you understand the difference between the two, and then we'll go into the further details. Fine. So let us start. The first thing is fermentation. What do they ferment? Okay, now the fermentation property of most of the bacteria are important. Okay, what do they ferment? So pneumococci fermented inulin. So similarly, when we come on to the gonorrhea, it ferments glucose. Okay, it ferments glucose. Now just note it down. I'll tell you the technique to remember these chart. Okay, now glucose. Now whereas this ferments glucose plus maltose. Okay, plus maltose. So two things. Fine. Glucose plus maltose. Now oxygen requirements. Note that both of them are aerobes. Both of them are aerobes. They require very typical conditions to survive. We'll go into details of that, but note that both of them are aerobes, but the difference is that they can survive anaerobically, These are strict aerobes. Okay, these are strict aerobes. Now there is something known as vertical learning. Okay, there is something known as vertical learning rather than horizontal learning. So some people like horizontal learning, some people like vertical learning, but overall what I have seen is if you go for vertical learning, it becomes much more easy to remember things out, like this way: fermentation, oxygen requirement, capsule, biochemical, genetics. This, so glucose can be anaerobic and so on. Okay, just try it. And there is another method which is called memory palace, which I am going to teach you today to learn this chart. Okay, so you can form your own memory palace how much ever you want. Okay, but the only thing is you have to keep revising them. Only way to remember microbiology, pharmacology and all is to just revise them. No other option, dental materials or whatever. It's typically you have to revise, keep on revising them. Fine. Now the next property is the capsule. Are they capsulated or not? So remember, these the gonorrhea are non-capsulated. Okay, don't confuse. Again, I'll tell you how to remember. Non-capsulated, whereas these are capsulated. Just write it as positive or capsulated, and the capsule is polysaccharide. Remember this; it's very important. The capsule is made up of polysaccharides. Okay, polysaccharides. So gonorrhea are non-capsulated, meningitidis are capsulated with polysaccharide capsule. Now some books, I don't know, especially the MCQ books, they say that these are also capsulated and it contains polyphosphate capsules. I couldn't find it in any of the standard references, but yes, just know it down. Okay. Now biochemical reactions, important, these are oxidase positive, so both of them are oxidase positive. So these are also oxidase positive plus catalase positive, so two positivity. Okay, so the gonorrhea are oxidase positive, these are oxidase plus catalase positive. Okay, oxidase plus catalase positive. Now, what about genetics? Genetics in the sense, this contains lots of plasmids, several plasmids. Okay, lots of plasmids, several plasmids are there, including those plasmids which code for the resistance. Okay, code for the resistance, and this resistance is much bigger problem on this side rather than this side. So it contains fewer plasmids. Okay, this contains fewer plasmids. Now, once again, a quick revision. This can ferment only glucose. This ferments glucose and maltose. Oxygen requirements, these can survive in an anaerobic environment. This very strict aerobe. Okay, very strict aerobe. Now, capsule, these are non-capsulated. These are capsulated with a polysaccharide capsule. Biochemical reactions, oxidase plus catalase. Now, another organism you remember now which are catalase positive, which is Staphylococcus, isn't it? Staphylococcus are catalase positive. Then coming on to genetics, these have very fewer plasmids. These are having several plasmids. Just note that these are plasmids. Okay. Now, so yes, I forgot to tell you the shape, isn't it? Forgot to tell you the shape. So I'll just add somewhere here. Okay, or morphology, not written, huh? Fine, I'll just add here as morphology. So just note it down in your book. Okay, morphology. And I'll use the same color so that you don't confuse. Okay, so these are kidney shaped. These are kidney shaped. Whereas this is half moon shaped. Half moon. Both are diplococci. Both are much more towards lenticular shape, but this is more a kind of kidney shape. Okay, kidney shape. Okay, and this is kind of, half moon shape. So it's like this, half moon. Diplococci, isn't it? So this is two kidneys like this. Diplococci, that is half moon shaped. I'll just show you on my first image, which you can see there, which is the gonorrhea, which is kidney shaped, and on the other side you can see the image of the meningitis, which is half moon shaped. Okay, so hope you can remember this image also, because at times they can give you all these characteristics. So how they fool or how the trick, I would say, the students is by giving the details in the question which is sufficient to answer, plus they will give you an image. Again, students say that, oh my god sir, there were lots of image based questions. Okay, so the examiner know very clearly that if a student, most who are not very well prepared, okay, and who is not confident enough, told you about confidence, isn't it? So is not confident enough, they have the problem that they see the image, they are just fearful. They don't go into those characteristics which will say you that these are diplococci, these are fermenters of glucose and maltose, okay, and they have a polysaccharide capsule, oxidase plus catalase positive. So all these will be there, which will be giving you a clue, which will tell you that this is a particular organism. But instead of that, the student will concentrate more towards the image, and they will not answer it. So just note it down. This is the image, and as I've told you how to remember this. So fermentation, glucose and maltose. So you can see here G, isn't it? Glucose and maltose, and it is M. Isn't it? So remember that is glucose plus maltose. So remember that both ferments glucose. Now, oxygen requirement can be anaerobic, strict aerobe. So how you can remember this in a memory palace of meningitis? Okay, meningitis, which causes meningitis. This causes gonorrhea. So how you can remember them? In a kind of memory palace, remember that this is much more serious infection, meningitis, infection of meninges. So what is meninges? We'll study them. Fine. We'll study if you don't know, you should be knowing it. Okay, the outer covering of brain, okay, the protective covering below the skull. Okay, so it's an infection of meninges. So it's much more serious infection. So we'll memorize or form a memory palace of this. So just know that there is inside the brain, Okay, or just imagine something like a big brain. Okay, inside that there is a room. Okay, there is a room. Okay, which is brain itself is a kind of half moon shape. Is it kidney shape? No, it's kind of half moon shape. So it's a half moon shaped brain. Inside that there is a room, and in that room there is a plate of rice. What is a plate of rice? Polysaccharide. You know, rice is a kind of polysaccharide. So it tells you that it's a polysaccharide. What is a polysaccharide? It's a capsule which is polysaccharide, and there is an air condition. So there's a room inside the brain, okay, which a plate of rice and a good AC. What is the AC telling about? AC. Okay, AC means aerobe. You can also remember it as like it's air conditioned air, aerobes. C is catalyst positive. Okay, catalyst positive. So just try to remember this memory palace, and this is done. One is meningitis. Okay. Okay, meningitis, maltose, it's brain, so all this are connected. Okay, then you have got a plate of rice, AC. Okay, fine, easy. So you can easily remember them. Then AC is aerobes and catalase positive, several plasmid. Just know that it contains several plasmid. So just a completion of differences. I've said this about the several plasmid concept. Okay. Otherwise, the rest of the things is sufficient. And on the other side, if that is AC, this is only oxidase. This is aerobe means can be anaerobic. Maltose means only glucose. Okay, shape. You know, if one is half moon, the other is kidney. So another way to learn when you're learning a chart is to learn one side and the other side is opposite. Okay, don't try to learn both, because that can confuse you at a later stage. You don't know what is what. You'll forget it. Now see, whatever you are learning, whether you are learning by memory palace, whether you are learning by mnemonics, whatever it is, or any other clues or anything, the key is that if you don't revise, you'll forget it. So as I've told you, whenever you are learning a new bacteria, for example, you are learning, you started, probably you are listening to my lecture, isn't it? So make sure you have done all your bacteria, you have rushed through all the previous bacterias in the beginning, half an hour. It gives you, most importantly, it gives you that positivity, that energy which is required. Okay, so please make sure you're revising, please make sure you're putting efforts. There are students who are very, very easygoing initially, then they come in the end. The last 4 months, they were like not at all concentrating, not at all bothering to respond, not at all interacting, no, nothing. In the last, okay, they become a little greedy because their friend is now talking about entrance preparation. She's confident. She's saying that I'm getting this good rank, I'm getting that good things and all. Okay, so now this student also thinks of, now I need to prepare. No problem. At times you can get through. At times, definitely, it's never late. Okay, it's never late for entrance. So, but the thing is that I've seen these students finally coming and complaining, "Sir, my rank is this, what will I do? I thought, I am totally disappointed, I am totally tired." Then I see the previous messages of the student who have messaged me. It is 6 months back, 7-8 months back. So when I asked them, send me your progress, okay, send me your details, where are you now? How is your lectures going on? Are you understanding concept? No response. No response. Okay, but when they come on to their side, now they have got a rank of 2000 or 3000 or 1500 or 500 even. What will I do now? What should I do? Can you help me? No way to help you, because you're too late. You're too late. Okay, so don't be. Now you're starting your preparation. This is your first subject. Make sure you are serious about your preparation. Make sure you are putting your efforts. This is so easy, so comfortable. Okay, we have just started with microbiology. We will make you understand the concepts. The lecturers will make you understand the concepts. Don't worry. Only thing you have to do from your side is to revise them. Keep revising them. Keep doing them. Make it simple. Don't be over enthusiastic. Don't don't put yourself into trouble by overdoing things. Just do the simple things, just do the lectures, take down the lecture notes, revise the lectures, do your dental pulse synopsis. Okay, that's enough. Do the academic questions. Enough, more than enough. Now, if you want aims, it's a slightly different story, definitely, undoubtedly. It's a slightly different story. You have to do a little bit more, but not too much. Yes, for example, you are doing microbiology. Now, microbiology is is it a very important subject for aims? No, it is not. If you do this much itself, you will get microbiology, understanding the concepts here, what is the type of reactions taking place here, instead of just mugging up, just understanding the concepts here, not into depth, whatever is being taught, enough. Okay, like they will give you, as I told you, the patient came with the bacteria cultured, catalase positive, coagulase negative, like that. So if you can tackle that kind of questions, your microbiology for aims is done. If you are doing your dental pulse, your academic questions, and your understanding somewhat here, your NEET is done. But when it comes to more clinical subjects like orthodontics, periodontics, I would suggest you to go into the image-based questions of the textbook. If you want to read a little bit of textbook, a little bit, okay, wherever selective you want to read, you want to read a particular concept which has come for aims, so you have to understand it, no problem. For a clinical subject, I would suggest you if you're going for aims, if you're attempting for aims, do a little bit of reading of textbook, especially subjects like orthodontics, periodontics, all the clinical subjects. But when it comes to your medical subjects, just follow Dental Image Academy. Just follow Dental Image Academy. You doesn't need to do anything. For NEET, yes, again, if you're someone just concentrating on NEET, follow Dental Image Academy, even for clinical subjects, which will be sufficient. Fine. So that's the first part, the comparison. Now we'll go on to some general characteristics of both the bacteria. Not just comparison, the commonalities. Okay, what is common in both of them? Okay. Now coming on to some general characteristics, as I told you, the first thing which you have to note here is they are commonly oxidase positive, whereas meningitis is AC, isn't it? Catalase positive also. Now, oxidase positive means they produce a purple. Okay, purple. Okay, let it be orange, no problem. Okay, they produce a purple or deep purple discoloration, and you can find that there's a method called Kovacs method. You don't need to know into details. Okay, you are preparing for entrance, you are not preparing for your theory exam. So just know that the oxidase positive test is analyzed by a test called Kovacs method or Kovacs test. Okay, where the organism, whether it's Nesseria, gonorrhea or meningitis, causes a deep purple. Okay, let it be not just purple, deep purple appearance. Now, media. 3 medias you have to learn: non-selective, selective and transport. Okay, and please note, non-selective media is used in acute cases where you can find lots of organisms. Okay, there is lots of organisms and it is growing well, means use non-selective media. You don't need to specifically go into a particular media. Okay, so doesn't need to go into a selective media, which is much more costlier, isn't it? So now, but it's a chronic case where the organisms are very little. Same applies to all the organisms. If the organisms are very little, you have to selectively, or if it's a mixed culture, you see another diplococci also, or you see other staphylococci, streptococci. Very typical example is for gonorrhea itself, the vagina of definitely it causes gonorrhea. So the vagina or the cervix of the females contain lots of other mixed organisms. So if you try to culture from there, if you take the swab from in fact you can't take vaginal swabs for gonorrhea, I'll tell you why. But if you take the swabs from cervix, you'll see mixed organisms, and if you just give simple media, all the organisms will grow. Instead, you give a selective media which allows only the gonorrhea, Nesseria gonorrhea, to grow. So that's what it is used. Now, transport media, what is the importance? So why do you need a transport media for Nesseria, whether it's Nesseria gonorrhea or meningitis? So it's a common thing. Okay, it's common for both gonorrhea and meningitis. So why do you need? Because both of them dies immediately outside the body. It's a strict human parasite. Nesseria are strict human parasite. They can't survive outside the body. So you need, if you want to transport them, if you're not plating it right away, if you're not culturing it right away, you need to transport them, so you need to go for a transport media. Now let us see the non-selective media examples. Now, chocolate agar. Okay, chocolate agar. Okay, or I think even blood agar works out. Yes, blood agar. Okay, all the simple medias. Okay, blood agar, chocolate agar. Okay, then you have got the Thayer-Martin media. Thayer-Martin media, don't confuse. It's not selective. I'll tell you which form of Thayer-Martin is selective. And then you have got a very, Muller. Okay, very tough names. Muller-Hinton, starch-casein, very fun, isn't it? Starch-casein, hydrolysate agar. Now, how can you remember? You're going to see hundreds of such big names. How can you remember them? Can you by heart them? Yes, initially try to by heart them, but don't insist. Don't insist that I'll learn it today itself. You need to keep on revising them. This is how you remember by revision. These are things which you need to remember by revision. If you just learn it today, fine, you'll find it wonderful. I know it, but you take it after 10 days, you've forgotten it. You have to then again by heart it. See, the comfort of revising and keeping it there is by developing a photographic memory, not that, mugging up memory. I'll keep on saying this because people don't understand the importance of revision, especially the initial phases. The thing is to develop a photographic memory. You see it every time. Okay, and you have seen what you've written every time. It becomes super easy. At any stage you take, you don't feel that you are doing something fresh. You always feel that you are doing something which you know. And just imagine, after microbiology, anatomy, orthodontics, periodontics, 10 subjects, you are very familiar. How much confidence it can build within you. Yes, wonderful. It's going to build up a huge confidence within you. That's the key. So please don't waste your time. If you're into your preparation, even if you're an intern or if you're a BDS student, fine, enjoy. Learn it and enjoy, fine. Okay, but if you're an intern, don't waste your time. Your friends will say you that, oh my God, you're preparing, you're doing that, you're doing this. Don't worry. It's going to pay back. So put your efforts. I have seen more interns by proportion getting into NEET and AIIMS, especially AIIMS, than repeaters. More interns. Why? Because of several factors which I'll tell you one day. Okay? But please note, it's by proportion. I'm saying that, for example, 10 interns are writing, 10 repeaters are writing. You get more interns from no, it's not all the interns, it's serious interns, okay? 10 serious interns are writing, compared with 10 serious repeaters are writing. You get more interns. Now, I'm not discouraging, it's not a discouraging thing to the pass outs, because interns are never serious. You say them 100 times, they don't understand the importance. Yes, out of 1,000, a few, 10, 15 people understand the importance and they do it and they get through. But otherwise, it's very difficult to convince these people, interns. Okay, now, so that's about non-selective media. Chocolate agar, blood agar, Thayer-Martin, Muller-Hinton, starch-casein, hydrolysate agar, okay, are the non-selective media. Now you go on to selective and a little bit on selective media, and you have left is transport media, isn't it? You have left with it transport media. Now there are two selective medias which you have to learn. One is modified Thayer-Martin. I'm not writing the entire sentence or entire thing. Modified, so Thayer-Martin is a non-selective media, whereas modified Thayer-Martin is a selective media. Now another media is New York media. New York media. Okay, New York media. And the transport media for them is Stewart's media. Stewart's media. Okay, Stewart's media. Now, how to remember them? I'll tell you, don't worry. Okay. Now, but you have to know the composition of, okay, the modified Thayer-Martin media. How to remember the composition of modified Thayer-Martin media? Remember Cat-Van. Okay, Cat-Van. C-A-T-V-A-N. Now A is out. Okay, just to form the mnemonics, it's Cat-Van. Okay, Cat-Van. So C for colistin. T for trimethoprim. V for vancomycin. All these are antibiotics. Why? To suppress other bacteria. Fine. And N for nystatin. Okay, nystatin. So colistin, trimethoprim, vancomycin and nystatin. So Cat-Van. Remember Cat-Van. New York media, you don't need to know the composition. Stewart also, you don't need to learn the composition. Now, how to remember? Just know modified Thayer-Martin is a selective media. So remember that Taylor-Martin, just a Taylor, you know who is Taylor, from New York. Okay, so he's a Taylor. He sends or transports his, again, memory palace, transport his tailored products by a person called Stewart. Okay, by a person called Stewart. So the Taylor-Martin in New York transports his goods through a person called Stewart. Okay, so if you can remember that, then this side becomes easy. Then it is Cat-Van. Okay, it's Cat-Van. Fine. So that's it. Okay, that's it about the selective and transport media. Now we go on to the Neisseria gonorrhoeae. Okay, the first organism among the two, which is Neisseria gonorrhoeae. So the first organism is Neisseria gonorrhoeae, and we're starting with two things. One is growth requirements, and second is the biochemical reactions. So growth requirement, there is a growth factor. Okay, growth factor. As I've told you, these organisms are very, grow only in a very strict conditions. Okay, they don't grow just coming out of the body, usually they die. So you need to maintain some strict conditions for their growth. You have to provide some growth factors for their growth, and one is glutathione. Okay, glutathione, again easy to remember. Okay, glutathione. Okay, glutathione. Then I've told you these are organisms which can survive anaerobically, and usually 5 to 10% carbon dioxide. 5 to 10% carbon dioxide is essential for their growth. Okay, or to promote their growth, we have to provide 5 to 10% carbon dioxide when you grow them. Fine. Now, biochemical reactions, you have to know something known as RCUT. RCUT. What is RCUT? Rapid carbohydrate utilization test. Okay. Now, this is becoming a very important test in diagnosis of gonorrhea now. Okay. RCUT. So they can ask you what is RCUT, or which of the following test is used for analyzing the biochemical reactions. What biochemical reactions are we talking about? Fermentation of glucose. Okay, fermentation of glucose. To analyze the fermentation of glucose by Neisseria gonorrhoeae, what test is being done? RCUT, rapid carbohydrate utilization test. Now, why is it rapid? Because of the presence of enzymes in this bacteria. It's not that. Usually, how would you check for fermentation? The bacteria grows in that media, and you have given some carbohydrate, now in this case for example glucose, the bacteria grows and eats, okay, or depends on, takes in the glucose, and that's how the test, or that's how the fermentation occurs. Whereas this is, in this organism it is very rapid. You don't need to go into so much of details though, but just for your understanding, there is enzymes, okay, there is enzymes which they release and they digest the glucose. Instead of growing in a good quantity and then utilizing it, they use enzymes. So that's why it's rapid carbohydrate utilization test is the key here. Okay, so just know glutathione is a growth factor, carbon dioxide. So the most important thing, glutathione and RCUT, rapid carbohydrate utilization test. Now we go on to the next property, which is the antigenic properties. And in antigenic properties, you have to know the name of antigens. Which of the following are antigens of Nesseria gonorrhoeae? They will ask you. And please note, there is no capsule here. But when it comes to the meningitis, Nesseria meningitis, you have the capsule there, isn't it? You have the capsule. Why? The meninges, oxygen, okay, the plate is there, carbohydrate plate is there, so there is capsule as an antigenic factor. Here the capsule is not an antigenic factor, it is pili, outer membrane proteins, we will go into details of it, endotoxins and IgA protease. Now pili, so basically one thing which comes here, now we have started gram-negative organisms. Did I tell you that? No, I think. These are gram-negative diplococci, just note it down there. Okay, these are gram-negative diplococci and not gram-positive. So far we were talking about staphylococci, streptococci, pneumococci are gram-positive. These are gram-negative, and when we come on to gram-negative organisms, they have, okay, there is a comparison definitely, we'll study later on, but in gram-negative, in general, not a rule, in general, there is exceptions. Okay, in general, they have got endotoxins, whereas gram-positive have got exotoxins. So endotoxins means they have their toxin attached to their cell within them. Okay, whereas exotoxin means it is released outside. So these are endotoxins. Okay, when you come on to gram-negative organisms, they have got endotoxins, okay, which will be a very important antigenic property, which is very important in their pathogenesis. Fine. So let us go like one by one. Fine. So when you come on to pili, there is normal pili and 6 pili. Okay, and the very important thing which helps, or what is the role of this, is attachment. Attachment to the host cell and attachment to the adjacent bacteria for reproduction. So pili, attachment and phagocytosis. Okay, prevent or resist phagocytosis. Now this is that is why it is a very important in their virulence factor. They inhibit phagocytosis. Okay, then when you come on to the next one, which is outer membrane proteins. Now these two, both endotoxins and the outer membrane proteins are seen on the cell membrane. Okay, both of them. But now here you have to remember 3 outer membrane protein, type 1 outer membrane protein, type 3, type 2. Why have I written 1, 3, 2 instead of writing 1, 2, 3? Now this one is the most important one. But these two, 1 and 3, okay, both of them are helping in attachment. 1 and 3 has got a common function, that's why I wrote it together. They helps in attachment, okay, plus they act as sporins. That means pores, minute pores for exchange. Okay, so they act as sporins for exchange of particles between the two cells. So 1 and 3, of which 1 is most important, and this helps in attachment and also act as sporins for exchange of materials. 2 is opacity associated outer membrane protein, OPA. It's called as OPA. Opacity associated outer membrane protein means if a bacteria has an outer membrane protein 2, or if a Nesseria gonorrhoeae has got an outer membrane protein 2 and it secretes it, or if it is present, you will see the colonies are much more opaque. If they don't have this two, it's very much clear. You don't need to learn this. Just know 1, 3, 2 and what's the role. See, certain things you don't need to go into depth, but it will help you to understand what this opacity associated outer membrane protein, OPA. So which of the following is OPA? 2. They'll give you 1, 2, 3, 4. So it's 2. Okay. Don't think that you are learning everything perfectly, you remember, but when the question comes, you'll forget it. So that's why developing a photographic memory is very, very important. Okay. Now endotoxins, this again they are present on the outer membrane, and it is lipopolysaccharide. The composition, what basically endotoxins are, these are lipopolysaccharide, lipids and polysaccharides. We'll study into detail. So these are lipopolysaccharides. Okay, lipopolysaccharides on the outer membrane, these endotoxins. Okay, fine. Then you have got IgA protease. Now the role of IgA protease, we'll go when we study about different antibodies, we will learn that there is an antibody called IgA, especially in your saliva. Okay, in your saliva, it's a very important antibody in your saliva. So IgA is very important for our immunity. Okay, especially the organisms, to kill the organisms. So antibodies basically. So now IgA protease, what they do is they just cleave the IgA. Okay, they break down the IgA, they destroy the IgA. So that's the role of IgA protease. So what are the virulence factors, or what are the antigenic properties? Pili, outer membrane proteins, endotoxins, and IgA protease. Vertical learning. It's attachment and phagocytosis. This one has got 1, 3, 2. Okay, 1 and 3 are attachment plus 4 is 2 is OPA. Then endotoxins, LPS, IgA protease, you know now what they are. Fine. Now we come on to another very important part, which is pathogenesis. Okay, pathogenesis of the Nesseria. So very important 4 terms you have to learn here is, one is gonorrhea. Second is very much related, second and third and fourth, all are related to gonorrhea only, but just to know these terms, I have written it here. It is water can perineum. Okay, I'm going to discuss this. Then there is something known as Fitz-Hugh-Curtis syndrome, Fitz-Hugh-Curtis Curtis syndrome. Then there is ophthalmia neonatorum. Why is it important? Ophthalmia neonatorum. All these are venereal disease. Okay, all these are venereal disease, means these are sexually transmitted. Neisseria gonorrhea is a sexually transmitted disease. It's a venereal disease. It's a strict, write it down. Neisserias are strict human parasites, whether it's meningitis or gonorrhea. And gonorrhea causes the venereal infection, sexually transmitted infections, and it is at a very high rise. I will tell you why. Okay, definitely the unethical practices, what they do, and whatever you call it, you can call it now unethical, isn't it? It's not unethical anymore, but unfortunately. So yes, gonorrhea is sexually transmitted. These two are also associated and sexually transmitted, but ophthalmia neonatorum is important because it is not sexually transmitted. Okay, it is not sexually transmitted. I'll tell you why. Okay, that's the importance of it. So which of the following, they'll ask you which of the following gonorrheal infections are non-venereal. Okay, non-venereal. Okay, that's, you have to know what is this. So now let us discuss them one by one. Gonorrhea, the name gonorrhea says or it means that it's flow of seeds, because like while the person is urinating, you will see a flow of the organism. So it's called flow of seeds. Fine, flow of seeds. Now, its symptoms are very, very, very important. Okay, it causes urethritis. So it's a triad of urethritis, prostatitis, that is inflammation of prostate gland, and conjunctivitis. So how does conjunctivitis comes here? When it is a sexually transmitted, because touching with the fingers. Okay, that is transmission from the sexual organ into the eye. So urethritis, prostatitis, and conjunctivitis is a triad of gonorrhea. Now, one thing which I want you to note is that Neisseria gonorrhea is the most common cause of urethritis in males. Okay, most common cause of urethritis in males. Also, the most common symptom associated with gonorrhea in males is urethritis. Two things, most common cause of urethritis in males is Neisseria gonorrhoeae. Most common symptom of Neisseria gonorrhoeae in males is urethritis. What about then females? As I told you, they will have cervicitis. Okay, the most common, so females. The most common symptom in females is cervicitis. Okay, cervicitis or cervix. Now, I've told you the most common cause of urethritis in males is Neisseria gonorrhoeae. So, is there any other cervicitis or any other such infection? Yes, one more thing we have to note here. That is, if the second organism which causes the urethritis is Chlamydia trachomatis. It's called non-gonococcal urethritis. Non-gonococcal urethritis. You have to just know here. Okay, or it's called non-specific. Okay, gonococcal is specific. Non-specific urethritis, which is due to the organism Chlamydia trachomatis. Okay, Chlamydia trachomatis. Just in MCQ perspective, the second most common cause or non-trachomatis. Okay, Chlamydia trachomatis. So non-specific or non-gonococcal, the most common non-gonococcal urethritis is by Chlamydia trachomatis, or non-specific urethritis is by Chlamydia trachomatis. So this is very important. The triad: urethritis, prostatitis, conjunctivitis. Most common cause of urethritis in males and most common symptom in females, it is cervicitis. And if it is non-gonococcal, the most common cause is Chlamydia trachomatis, which is also known as non-specific urethritis. Now, on my left side, you will see what is urethra. Just see the image, urethra. Okay, urethra, which is associated where the urine passes. Okay, the tube where urine passes from the urinary bladder, from the kidneys, urinary bladder, it comes in, it passes through the urethra coming out of the organ. So, if this gonorrheal infection infects per urethral tissue, that is around the urethra, okay, per urethral tissue, that is tissues outside the urethra or around the urethra, then what happens or what is seen is, you will see abscess. Okay, you'll see lots of abscess plus multiple draining sinus. Okay, multiple draining sinus. Okay, multiple draining sinus. And this condition is known as water can perineum. Okay, where draining sinus, water can perineum, kind of, draining. Okay, per urethral tissues. So if it affects per urethral tissues, it will be abscess plus multiple draining sinus, and this condition is known as water can perineum. Very, very, very simple, isn't it? Now, on the other hand, okay, if especially in females, okay, what is peritoneum? Peritoneum is the lining of the organs in the viscera. Okay, the lining, I'll just show you an image which just see there. Okay, the outer lining which you can see, okay, it's also labeled, it's the peritoneum. Now in females, especially in females, also in males, if this particular infection spreads from the reproductive organ through the peritoneum into the region of liver, okay, then it is called Fitz-Hugh-Curtis syndrome. Okay, Fitz-Hugh-Curtis syndrome. And what is seen, more importantly, it is perihepatic inflammation. Perihepatic inflammation. Why perihepatic inflammation? Why are they saying perihepatic? Liver is surrounded by a capsule, and capsule is a part of peritoneum. Okay, so what happens here is the infection is not directly into the liver or inside the liver, which you call it as liver parenchyma. So it is the infection not affecting the liver parenchyma, it is the infection affecting the liver capsule, which is a part of peritoneum. So it's perihepatic inflammation. Okay, it's a perihepatic inflammation with no involvement of parenchyma, but there is involvement of liver capsule. Okay, so this is called the Fitz-Hugh-Curtis syndrome. Okay, so hope you got the difference between Wartburg and perineum. It is much more again into the reproductive organ, but periurethral tissue. But Fitz-Hugh-Curtis syndrome is more towards goes into the peritoneum with perihepatic inflammation. Okay, with inflammation of the capsule and not parenchyma. Okay, and with many other symptoms also, but just know because it's a syndrome, but just know this much at least. Okay, and finally it is ophthalmia neonatarum. Now why is ophthalmia neonatarum important? I told you because ophthalmia neonatarum, just give the heading ophthalmia neonatarum. It's a non-venereal disease which is seen in newborn. Okay, newborn. When it passes through the birth canal, the baby is delivered, it passes through the birth canal and the mother is infected. Big problem, isn't it? So what you do, so it's a big problem, the ophthalmic or the ophthalmic region, the eye region gets infected. So that's ophthalmia neonatarum, newborn. Now, so it's, it's a big problem because many females are asymptomatic. It's a big problem overall. When the females are asymptomatic, they carry it in their reproductive organ. They carry the gonorrhea in their reproductive organ, and many females are asymptomatic. So the delivery becomes normal, and this normal delivery happens, and this child gets infected with this. Second problem, yes, sexual workers. Okay, unfortunately, many of them will be carriers, but no symptoms at all. Zero symptoms. So this can also spread but males can never be carriers. If male has it, male will express it, unfortunately. Okay, unfortunately for males. Okay, now how can you prevent this? They say that if you give 1% sodium nitrate drops. Okay, sodium nitrate droplets. Sodium nitrate droplets, 1% sodium nitrate droplets into the eyes, right away the child is born, you can prevent this. And it has got a name, it's called Kretz method. All these, it's very difficult to remember. So the only way to remember is to revise, keep on revising them, develop photographic memory. 1% sodium nitrate droplets, Kretz method. It's called Kretz method to prevent ophthalmia neonatarum. Just a quick revision of what I've told you just now. Yes, gonorrhea is urethritis, prostatitis, conjunctivitis triad. Most common cause of urethritis in males. Yes, non-gonococcal, non-specific, which is chlamydia trachomatis. Wartburg and perineum if it affects periurethral tissues. Fitz-Hugh-Curtis syndrome if it affects the peritoneum. Ophthalmia neonatarum, the only thing or the most important thing which you have to remember, it is non-venereal, and it is how to prevent is 1% sodium nitrate. 1% sodium nitrate. Now, yes, so that's about this. Now let us go on to lab diagnosis. So like all the lab diagnosis, this also has got specimen collection, microscopy, culture, everything. But two things I want to specifically discuss here is specimen collection and serology. Okay, specimen collection and serology, because these have been asked, and rest what is microscopy for? Gram-negative diplococci and all those. Okay, and then you come on to the culture. You do the culture of the organisms in the Thayer-Martin media. You see the cultural characteristics, their shape. Okay, you do the culture and you just see the cultural characteristics. Fine. Okay, and biochemical, you can go into biochemical reactions also from the culture, which we have seen, oxidase, catalyst, positivity, everything. But more important here, or something extra here, is specimen collection and serology. Okay. Now, in specimen collection, yes, definitely, you have to collect a swab from urethra. So, urethral swab or cervical, endocervical swab. Okay, you have to collect urethral or endocervical and never vaginal. Okay, I've told you, don't collect in the beginning, no vaginal swab. So it's either from urethra or cervix, not vagina. Okay, so why? Because these organisms doesn't survive in the vaginal region because of the high acidity of the vaginal secretions. Okay, so they can't survive. As I told you, they have got strict growth conditions. So this is important. Okay, not vaginal. They'll give you a swab is taken for gonorrheal infections from which of the following site. They'll give you urethral, enterocervical or periurethral, whatever, but one option will be vaginal. So it's never vaginal. Okay. Then coming on to serology, you have to know. So what is serology? Serology is something which detects antigen or antibody. Any test which detects antigen antibody is serology. We'll go into detail about antigen antibody reactions, hypersensitivity later on, but just write the names out there and try to memorize them, photographic memory. It is complement fixation test, CFT. Okay, complement fixation test. Pili agglutination test. Pili agglutination test. Okay, pili agglutination test and heme agglutination test. Heme agglutination test. There are a lot more, but at least remember this much. Okay, pili, you know it is. Pili is a very important part of antigenic structure. So complement fixation, they fix complement, their pili agglutinate, and when they combine with the RBCs, they agglutinate the RBCs. So heme agglutination test. Okay, so that's about the serology. Whatever way you want to learn, just learn. Okay, because here you are not becoming a research scholar. Okay, you are not going to write a theory-based exam, or you are not going to sit for Viva. So just any way to learn heme agglutination, just see, okay, heme agglutination, blood, gonorrhea is coming. Whatever you want to make a memory in your mind, you can do it. And definitely memory palace or memorizing or kind of mnemonics is not to remember it forever, just to clear your confusion. You're sitting in the exam, okay, don't think that I will form mnemonics today and I'll form mnemonics for all the topics, and just the day prior to the exam I'll revise this mnemonics and remember. No, that's not the key. The key for mnemonics or memory palace is that you are sitting in the exam, you get a question, you have a confusion. What is going to clear your confusion? This memory palace. Because you have revised it so many times, definitely any confusion comes, the memory palace also comes into your mind. And the mnemonics, if in case you have made a mnemonics, that also will come to your mind. Cat-vam. So you see cholesterol, okay, trimethoprim, vancomycin, nystatin. So any other thing other than this is there, you will not forget. Now, instead of cholesterol, they say cephalexin. See, both are C. Can you remember it by mnemonics? Okay, cholesterol is there. They say cephalexin in the option. Can you remember it by cat-vam? No. That is where revision is the key. You have to know that it is cholesterol. It is not any other C, it is cholesterol. Okay, fine. So that's about specimen collection and serology. Okay, and finally we come on to the treatment part. Now here in treatment, earlier, yes, penicillins were used. Okay, penicillins were used. But now what happens is that these organisms are starting to produce beta-lactamase, especially in the foreign countries where these countries like USA, this disease is at a very high rise. Okay, beta-lactamase. So it is understood that this will not work anymore, isn't it? This will not work anymore. So what there is Center for Disease Prevention, USA. Okay, Center for Disease Control and Prevention. Okay, that is Center for Disease Control and CDCP. Okay, USA. They recommend certain antibiotics, or they recommends they have given a regimen. Okay, they have given a regimen. They say that give ceftriaxone or ciprofloxacin Fluoxetine. They give ceftriaxone, which is cephalosporin, we study in pharmacology, and then ciprofloxacin. Now, is it that you wait for pharmacology to study all these. No, never. You study, you try to revise it now itself, learn it now itself. When it comes to your pharmacology, you'll remember, yeah, we studied ciprofloxacin there. You studied ceftriaxone there somewhere. Then you are combining them together, it becomes easy for you. Fine. So it's ceftriaxone, ciprofloxacin. Then there is, you can combine now, along with the above, either of the two above, you can combine tetracycline. Okay. Doxycycline, I would say. Doxy. Okay, not tetracycline. Doxycycline. Or azithromycin. So got it. You can either use either of these two separately, or you can combine them with either of these two. Okay. So it is, this is plus here. This is or. Okay. Means this or this. If you want to combine with this or this. Okay. Now dosages is also important. Not important, I would say. They have not asked it, but still it's good to know because it's CDC, Center for Disease Control, USA, isn't it? So ceftriaxone, the dosage, if you can remember them, it's 125 milligram single dose IM. Okay. 125 milligram single dose intramuscular injection. If you're using ciprofloxacin, it is single dose 50 milligram. Again, single dose, I'll just SD oral. Okay, single dose oral. So this is 125 single dose IM, 50 single dose oral. Okay. Then doxycycline, if you're using 100 milligram twice a day, not single, twice a day for 7 days, into 7 days. Okay. 100 milligram again, definitely oral. Doxycycline is given oral only. So 100 milligram twice daily for 7 days. And if you're using azithromycin, it's 1 gram azithromycin, single dose oral. Okay, single dose. Azithromycin is given usually for 5 days, 3 to 5 days. Okay. You can give it for longer. Now, again, ceftriaxone, memory balance, sorry, vertical learning. Ceftriaxone, ciprofloxacin, plus, okay, either of these two, plus doxycycline, azithromycin. Okay, so 125, 50, 100, 1. Especially the numbers, try to learn them in a vertical manner. Never learn it like this. You'll forget them. So, if you can remember 125, 50, 100, 1. You can't remember right now. You have to revise it multiple times. If you revise multiple times, 125, 50, 100, 1. Now, I would recommend you all. Now, last year, many students made this mistake. Even I told them to do it, but they didn't do it. Finally, all these problems you're going to face in the end. Now, you have very lenient timings, no issues. But if you are not following Dental Amaze Academy very precisely, the problem you're going to face it later only, not now. Okay, so be very careful when you are being told something. So it's good to maintain another separate book for all the values. All the values, maintain separate book, especially the important values. Now this is very important, not very important, but still if you can write it there in a separate book, and in the end, so subject wise. Okay, subject wise. So take small book, start microbiology. Whatever values you have learned in microbiology, write it there. Okay. Even if you are not writing the heading also, no problem, because you have all these things in another book. So that other thing is for your daily revision. Even after microbiology is over, you will revise it. Now a student one asked me, sir, do values come in the exam? Definitely they will come in the exam. Why not? Okay, values do come. Don't think that examiners have become very advanced, that they are no longer asking values. No, they do ask you, because the purpose to ask values is to filter those students who have taken effort. Okay, it is no. See, you have to, in a competitive exam there should be a filtration. So one way to filter is to ask you values, or ask you something very tough, or very not tough in the sense tough to remember. Okay, or confusing, so that you can filter those students who have learned better. So make sure you are maintaining a book which is having values, okay, and keep on revising them. Why is it important? Now, even if they don't ask you, even if not even a single value comes, but can you say that it will not come? No. So in the end, if you are very thorough with the pharmacology classifications, if you're very thorough with the all the values, it builds up your confidence. You feel that, you know, that you have done something wonderfully well. If you are very confident with all your notes, you have revised them multiple times, you are very thorough with your notes and your dental pulse synopsis, it can add immense confidence in you. So that's the key, okay? That's the key which you have to be very careful about. Fine, okay? So it's all about confidence, it's all about revision, it's all about maintaining a positive attitude. If you can do these things and keep on revising. Now once a student told me, so my friend was a very ordinary student and she got this rank, and I was such a brilliant student in my college and I got this rank only. No comparison of your BDS marks and your BDS knowledge in NEET. In NEET, what matters is not your brilliance, not your ability, not your genius nature, nothing. It's the amount of effort you put. Okay, it's the amount of effort you put and the amount of the guidance you follow. Definitely everyone gets guidance. So everyone is guided. So how much have you followed the guidance properly? Have you followed the guidance properly? Yes, then fine. So how much is the effort you put? Don't worry if you were a very ordinary student. I've seen students who have failed in their BDS years and who have cracked NEET in the top 10. Definitely, if you're a genius, if you're a very hard-working person, if you've scored NEET, if you've scored good marks in your BDS, it's going to help you, provided you put the same effort others are putting. If you're thinking that I am a person who have got 60% marks or 70% marks, I don't need to study this again. Another example I'll tell you. One student who got a very good rank in the previous one of the AIMS exam. Okay, and then it went declining because you know every year 2 AIMS comes. Okay, so it went declining. The rank became worse and worse. Why? I asked why. So the student told me that, sir, I thought I know everything. I'll do something new. Okay, I'll do something new, which is because I've already scored a rank of 500 in AIMS, means I know dental pulse. I know whatever theory I've learned. So I thought I'll do something new. I'll start reading textbook. Foolishness. Don't. It's not that your lack of knowledge which you have gone problematic or which has given you a lesser rank. It is your lack of revision. It's your lack of revision which has brought down your rank. So the only solution, the only thing what you need to do in your next exam, if you're someone who has scored 1000, 500, whatever, the thing you have to do is to revise it better. That's it. You don't need to do anything. So the biggest problem, people think that they have gone wrong because they have no knowledge. Not that. They have not revised it properly. So if you can revise it properly, definitely you're going to be there. Okay, so let's have a very quick revision of most important points once again. So we said comparison, Nesseria, which is the lenticular, lens-shaped diplococci, gram-negative diplococci. Fermentation, glucose, here maltose also. Oxygen can be anaerobic, but these are AC, strict aerobes with catalase positivity. Morphology, kidney, half moon. Capsule, not capsulated, yes, here there is rice. Biochemical, oxidase, and then there is AC. Genetics, more plasmids here. Fine. Then general characteristics, oxidase, deep purple. Remember this Kovacs method for oxidase. Media, non-selective, selective. Non-selective for acute, selective for chronic infections and transport media. Then you have got selective, which is modified Thayer-Martin media, which is CAT-VAN, New York transport is Stewart's. Remember that the Taylor-Martin's New York dresses were transported by Stewart. Okay, then we start with gonorrhea, yes, glutathione. Then you have got RCUT, that is rapid carbohydrate utilization test, due to enzymes. Antigenic properties, pili, outer membrane proteins, endotoxins, IgA protease. Yes, 132. That is the one is most important, attachment and porins. LPase you know now, IgA protease you know now. Pathogenesis, gonorrhea, the triad very important, urethritis, prostatitis, conjunctivitis, okay, and this is the most common cause of urethritis in males. If it is non-gonococcal, it is chlamydia trachomatis. Then you have got water can perineum if it affects the perurethral with multiple draining sinuses. If it's affecting the perihepatic tissue or peritoneal cavity, it's Fitz-Hugh-Curtis syndrome. Ophthalmia neonatorum, very important, sodium nitrate, non-mineral, okay. The name of the method is also very important, Credes method or Kretz method, okay, fine. Lab diagnosis, specimen never from vaginal. Serology, CFT, pili agglutination, heme agglutination. Treatment, penicillins are no more effective because of beta-lactamase, not any other mechanism, okay. Ceftriaxone, ciprofloxacin, doxycycline, azithromycin, 125, 50, 100, 1. Single IM, single oral, twice 7 days, single dose, okay, single dose daily for 5 days, fine. So there is no specific mention in the recommendations by CDC, okay. So I think I'll stop it here, and in the next class we'll discuss about the Nesseria meningitis. It's much more smaller, okay, it's much more smaller bacteria, and we'll go in detail of the meningitis, very important chapter, very important topic in general medicine. So just know the organisms here, and we'll go into details later on in general medicine. Fine. So I'll stop it here. Thank you so much. See you in the next class. Bye.